here at GlobeMed, we as college students recognize that we have an important role to play in improving health throughout the world.
The University of Michigan GlobeMed chapter impacts global health by collaborating with two grassroots health organizations, the Mali Health Organizing Project and the Joy Southfield Health and Education Center. The Mali Health Organizing Project, or MHOP for short, is located in a slum called Sikaroni, just outside of Bamako. MHOP empowers its community through its microfinance initiative, women's empowerment program, and the healthcare, education, and prevention project. Our GlobeMed chapter focuses on aiding this health project called Health in Our Homes. In 2008, we hosted our first annual benefit dinner to fund equipment costs for the new health clinic, which is currently in construction. This year, our benefit dinner will raise money for the education of community health workers.
When people think about global health, they often think about Africa or Southeast Asia, someplace far away, not close to us. And they often forget about places in our backyard. And so for us at U of M, Detroit is really close to us, and there are huge problems with diabetes, hypertension, asthma, and people don't really know how to prevent them or treat them. So we think it's really, really important to include the local scheme into our global way of thinking, because it still is part of the globe and it still needs a lot of attention. And so we partner with the Joy Southfield Health and Education Center in hopes of helping global health through local means.
We are on our way to the Joy Southfield Health and Education Center in Detroit, and we left from Ann Arbor about 25 minutes ago. This is a 40-minute drive only, and in this 40-minute drive, as we enter Detroit, the infant mortality rate doubles, and the access to primary care for each person is cut in half.
Primary care, as important as it is, if that's all we do, we're not really going to have a lasting impact on these chronic disease outcomes. So we realize that preventive health education and chronic disease management were going to be very important components that we have to use to supplement the primary care.
So we actually designed the building to have classrooms so we can have our health education programs. And the students from GlobeMed have been involved with us for about 4 years in helping get all of this come to life.
GlobeMed has played an invaluable role. So a year ago, just about a year ago now, in January of 2008, we finally went from having 1 or 2 people per class to having over 35 people attend a class in January.
The students from GlobeMed help us by helping get flyers together. They distribute flyers to areas in the community, to businesses in the community, churches.
At the end of every health class, participants complete surveys to give us feedback. They consistently answer that their health is improving as a result of the classes.
By responding to these surveys, people tell us that we are in fact making a change, and that's really important to see that we can make a lasting difference in the world of global health here in Detroit.
They're here to support the clients and support the volunteers and to support those of us that work here in the clinic. Day after day, they share our passion and they help us bring it to life.
We're very grateful for GlobeMed. They're the first chapter in the country to realize that global medical relief doesn't always mean going across the ocean. They support a project in Mali and they support a project in Motown.